So I'm going to add some 2021 updates for infection control basics. We'll review a couple things we've already reviewed, and then talk specifically about COVID-19, because that's the big infection for 2020 and 2021. So just as a review, the first, the body defenses, our first line of defense are our non-specific defenses, our mechanical barriers, our unbroken skin and mucous membranes, and secretions of tears and gastric juices. The second line of defense is non-specific, phagocytosis from neutrophils and macrophages, and inflammation. And so neither one of those two things were sufficient to take care of COVID-19 because it can get in through our mucous membranes through droplets. It's droplet transmission. Last year, they weren't sure if there were other forms of transmission. This year, we know it's droplet transmission. So that's why masks are effective, because it keeps you from sending your droplets out into the world. So a lot of people are confused on the function of masks. Even though Washington State is now open, fully vaccinated people can go without masks in public places, unless there are particular places that are an exception to this, and healthcare facilities are one of those places. Masks are still required in healthcare facilities. So if you are working in healthcare, like we are, you are still required to wear a mask, whether you're vaccinated or not. So the confusion comes when people think that wearing a mask protects them from the virus, and it doesn't. Wearing a mask protects you from spreading droplets, so it protects other people from the virus. So my mask protects you, your mask protects me. So even though I've been fully vaccinated since middle of January, I still wear a mask when I go in public places. Of course, I wear a mask at work because I have to. But I still wear a mask when I go to the grocery store, because I don't know what other people are doing. I don't know if other people are vaccinated or not, whether they're wearing masks. And so I'm not going to spread droplets. So I still wear a mask. So first line of defense didn't work for COVID. Second line of defense didn't work for COVID. The third line of defense is specific defense, and that didn't work for COVID either, because COVID, or SARS-CoV, which is the actual virus, and COVID-19 is coronavirus disease 19, which is the current one. We did not have any immunity to it because it is a new virus. So until it showed up on the scene at the end of 2019 and beginning of 2020, nobody had immunity to this virus. So our specific defenses weren't doing us any good. And here's the problem. And I'm going to talk a little bit more about this in the immunity chapter. But normally, when you encounter an infectious agent that you don't have immunity to, you can get infected by it. It takes a week or so to develop a response to it. If you survive, then the second time you encounter it only takes a short time to develop a response, because we have developed the specific defense of the B lymphocyte that remembers that virus. Well, if the first time you encounter it, it kills you, which frequently happens with COVID-19, you never have a chance to develop immunity to it. So that's why COVID-19 is a particularly pernicious disease, because a lot of times you die the first time you get it, and so you don't have a chance to actually develop immunity to it. So what do we need to do? We need to get vaccinated. So what the vaccine does is it teaches our immune system, it basically trains our immune system to respond to that threat. It teaches our immune system what this is, what it looks like, and so then when we see it, we're ready to fight it. So vaccination is the most important tool we have against COVID-19. You can wear masks, you can socially distance. Those are all great, but get vaccinated. That is what everybody needs to do. So I've heard all sorts of things. People say, oh, I trust my own cells more than I trust pharmaceuticals. Well, your own cells don't know what they're doing because it's a new virus. And the first time you get it, it can kill you. You don't have time to develop immunity. So getting the vaccine is the smart thing to do. Not only that, is healthcare professionals, it is our responsibility to protect our patients and protect vulnerable populations like the elderly, like the immunosuppressed. A lot of our patients basically are these compromised groups, and we need to protect them. So as healthcare professionals, it is your responsibility to get vaccinated. Okay, off the soapbox for that right now. So the pathogenicity I talked about a little bit in another lecture. It's the capability of a microbe to cause disease. So COVID-19 is very pathogenic. It has a high degree of virulence. It has the ability to avoid host defenses is its biggest point with virulence. So we have mutations now. We're up to Lambda, I think, is the new. The World Health Organization decided this year to start, instead of having confusing names with letters and numbers in them for the variants, they started calling them alpha, beta, gamma, delta, lambda. The delta variant is the most common variant in the US right now. The current vaccines that are available do protect against the Delta variant. The fewer people that get vaccinated, the more variants we're going to have. So as long as the virus is around, it is going to mutate and we're going to have more variants. So the more variants you get, in the Lambda variant I just read, there are some variations in the spike protein. Well, the vaccines that we have right now mimic the spike protein. They're the mRNA that codes for the spike protein, and that's how our immune systems recognize COVID-19 and go after it. So if you get too many mutations in that, it's going to decrease the effectiveness of the vaccine. So you don't want the virus to mutate. It's going to anyway, especially if people don't get vaccinated. That's just more opportunity. And viruses are going to take advantage of opportunities to reproduce themselves. And so having a susceptible host, hey, that's a great opportunity. So don't be a susceptible host. So newly emerging diseases, antigenically different forms of common infections. And that's what we're talking about when we're talking about the variants of coronavirus. Super infections with multi-drug resistant organisms, those are more bacterial infections, still a big issue. That didn't go away because of COVID. But interestingly enough, in a normal year, there are thousands of flu deaths in the state of Washington. You know how many there were this year? Zero flu deaths. And you know why? It's because people were doing what you're really supposed to do to avoid flu deaths. They were staying home when they were sick. They were wearing masks. They were staying away from other people. And seriously, if that's what it takes to eliminate flu deaths, why aren't we doing it? So infection control requires two approaches. So standard precautions used in all settings with all clients when body fluids may be exchanged. Respiratory droplets are body fluids. We're talking about that. So we need to, standard precautions mean you assume everyone's infected, period. And I think the thing that's been hard for healthcare workers in this last year is, sure, we always knew about standard precautions, but this year we had to kind of flip it a little bit and realize that standard precautions didn't mean just with patients. It meant with your coworkers as well. So not only did you have to assume that all your patients were infected, You also had to assume that all your coworkers were infected, and that was a hard shift for a lot of hospital workers, because normally you're in an isolation room, you have all your gear on and everything, and then you go in the break room and you take everything off and you eat. Okay, well, a lot of the infections in hospitals came from employees eating together in the break room. So we not only have to expand our thinking about standard precautions. It's not only assuming that all patients are infected, all body fluids are infected, but all of our coworkers as well. So that's a really hard shift, and it's a paradigm shift for healthcare workers. So you can't just assume that it's the patients who are infected. You have to assume that your coworkers are infected as well. Scary stuff. So this is our breaking the chain of infection. And so the thing that we're using to break the chain of infection for COVID is current immunization. But we're also using barriers, gloves, glasses, gowns, masks, and hand washing, disinfection, and sterilization. We're using all those things in the clinic to break the chain of infection. So it is important still to be healthy, be, don't touch your face in public, avoid areas where there are a lot of people, don't be a susceptible host, like keep your health status good. But I think the hard thing for a lot of people, a lot of healthy people who ended up getting COVID, they say, oh, I'm healthy, my immune system's strong, I don't have to worry about this thing. Wrong. Your immune system may be strong, but this is a new thing that it doesn't know about. So I think that the whole COVID thing has caused a lot of us to really shift in our thinking. Unfortunately, I don't think it's caused enough of us to shift in our thinking, but that's another story. So we're going to locate and remove or isolate the reservoir of infection. So that's our social distancing, isolating a reservoir of infection, and taking precautions when you're around people who are sick. Identifying and restricting access to contaminated food or water. Well, of course, COVID's not food or waterborne, but that for food or waterborne illnesses, that's important. Reducing contact between infected persons and the remainder of the population. That's where masks and social distancing come in again. Blocking portals of exit and entry, same thing. Remove or blocking modes of transmission. So if you're always covering your sneezes and you're talking and you're singing and you're yelling and your coughs, then you're blocking the mode of transmission. Reducing host susceptibility by immunizations, adequate nutrition, and access to healthcare. I've already said a lot about that. So there are currently vaccines that can prevent coronavirus disease. You can get one. You can get one for free if you haven't already gotten it. Now, for a while, there were lots of vaccine clinics set up. Now it's available at pharmacies and at your doctor's office. So if you haven't already gotten your coronavirus vaccine, now's a good time. Let's go do it. So the virus is the best way to prevent illness is to get vaccinated against the virus. The virus is spread from person to person via respiratory droplets. So between unvaccinated, unmasked people who are in close contact with one another, so within about 6 feet of one another, through respiratory droplets when an infected person coughs, sneezes, talks, shouts, or sings. Okay, so talking, that's just a normal thing. The droplets that are spewed out when you're talking, sneezing, coughing, shouting, or singing can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. That's how it works. So moral of the story, get vaccinated. Let's stop COVID in its tracks.